Body dysmorphic disorder, or BDD, otherwise known as body dysmorphia, is a mental health condition where a person spends much of their time worrying about flaws in their appearance. Although this condition can affect any gender or age, it is most common in teenage girls and young adults. Today, we want to learn and discuss more about body dysmorphia. Please join us. I'm Laura,
I'm Jesse.
And I'm Josh.
and this is Reconfiguring Reality. I was hoping to have a little more expertise on this
I have
podcast.
I mean,
personal
you kind of do. You
experience.
have someone who was diagnosed with this. That
Oh,
helps.
do we?
And
Okay.
I got, about my grandma or my
Yes.
grandmother.
Yes. So it's weird because when I think of it, of BDD, I immediately go to my son, who, of course, we all know is trans. But he has taught me that even though he is trans, he does not suffer from BDD.
No. Because with trans people, it's characterized as something else
Mm-hmm.
Are you
because they
talking
don't
about
see it.
body dysphoria?
I believe so.
Because they are two different things.
Hold on.
I'm keeping the keyboard clicking and
No. They have I believe gender dysphoria. Gender dysphoria stems from a disconnect between one's gender identity and the sex assigned at birth. They have gender dysphoria.
right,
Technically,
right.
I don't
And
see it
body
as a
dysmorphia is
gender
different.
dysphoria or a like body dysmorphia because of the fact they were just assigned the wrong sex at birth.
But what is body dysphoria?
Body dysphoria or
Dysphoria.
Dysmorphia.
Dysphoria.
body.
Hang with us.
Yeah. Body
Bear with us.
dysphoria is the feeling that your body isn't aligned with the gender you identify as.
Yes.
Oh,
Right.
well, body dys. Wait,
But body dysmorphia
yeah,
is just like it's feeling like your
they
body is
might
flawed.
have changed from one to gender. The gender. I'm not 100% sure. We'd have to look into that.
They're not, no, they're three separate topics. They're three separate
Yeah,
diagnoses. So
but
so of course I just hearing body dysmorphia, I automatically assumed that my trans son would be diagnosed with this, and I
Mm-hmm.
was corrected that that is not the case.
He went,
yes, because
hell no.
the symptoms of BDD is being extremely preoccupied with a perceived flaw in appearance that to others can't be seen or appear minor.
Right.
So, like for me, I still struggle with it, but it has always been my stomach because of the fact that my mom always dug at me about my weight.
Right.
And of course, being a mother and having children, one flaw a lot of women have is they have a little excess skin or like just stretched out skin from having children.
Or the pooch, as I
Yeah,
refer
like
to it.
I have a little bit of a fupa, is what I call it.
The fupa.
And it now, if you would have taken me back when I first was diagnosed as a teenager, I would have been like, I need to have surgery, I need to have this, I need to have that. And there's nothing wrong with having my little fupa. And yeah, if I really wanted to get rid of it, work out, strengthen the muscles underneath, stuff like that.
Mm-hmm.
But then you have a strong belief that you have a defect in your appearance that makes you ugly or deformed. Belief that others take special notice of your appearance in a negative way or mock you. Engaging in behavior aimed at fixing or hiding the perceived flaw that are difficult to resist or control, such as frequently checking the mirror, grooming, or skin picking. As a teenager, I was a big skin picker
I hid a lot.
because
hid my
I have
body a lot.
eczema.
Well, and then there's also eating disorders that are caused by people who are diagnosed with BDD.
And then attempting to hide perceived flaws with styling, makeup, or clothes.
Yep.
Constantly comparing your appearance with others.
Yep.
Frequently seeking reassurance about your appearance from others. Having perfectionist tendencies. Seeking cosmetic procedures with little satisfaction, and avoiding social situations. So have you guys ever seen the living Ken doll is what he was called?
From Botched, yes.
I believe I don't know if he was ever diagnosed, but a lot of people you see who do plastic surgery over and over and over and over again.
Is he still alive?
I don't know.
I think at some point they had to start denying him for surgeries due to how many he's had. There is a certain level and amount of times doctors are willing to put you under for anesthesia. And with the fact that he was becoming the human Ken doll, I'm assuming they started to kind of say no. That being said, there are doctors that will still do it, so I'm hoping he's alive.
He is still alive.
The Brazilian man known as the human Ken doll sadly died from complications of leukemia in 2015.
Hold on, wait.
Wait.
I don't think we're talking about the same guy.
Oh.
Because I have one here that is still alive.
So he's also known as people known as living Ken doll.
There are multiple I'm thinking of the human Kens.
Yeah, that's just.
Who were you thinking of?
I just put living Ken doll. I don't remember what the man looks like because I looked at him and I was just like, I can't.
I was thinking of the guy from Botched.
Oh yeah, that's the one I'm thinking of.
He's still alive.
That's the one from Botched.
He's still alive.
He's like the brunette.
That one's still alive. There was a Brazilian man that was also known as the living Ken doll, but he died at the age of 20 because of leukemia.
Due to complications. Yeah, leukemia. Yeah.
See, but this is where it gets confusing. So you may excessively focus over one or more body or parts of your body. The bodily feature that you focus on may change over time. The most common features people tend to fixate about include your face.
Wait. Let me guess.
Okay, sorry. Nope, that's just one of them.
I was gonna say nose, stomach, ass, and thighs.
Boobs.
So you were correct about the nose, but a lot of people have issues with their complexion, wrinkles, acne, and other blemishes. So the one feature on the face is the nose, but a lot of people struggle with, of course, as you get older, wrinkles, your skin starting to sag.
So like a lot of people go in for Botox, someone's Botox isn't really doing what they want. They'll go, "Hey, I want a facelift." Yep. Oh, well, after a while, your facelift and your everything starts to relax. I don't know if anyone's had like surgeries like that. I had an eyelid surgery because it was impeding my vision. And after a while, those muscles will start to relax from where the suture line is.
Yeah.
Interesting. I didn't know that.
Chesh can atone to this one. I had a minor freak out last week.
Yes.
Hair.
Yes.
So this just clicked in my brain why I had a little freak out about it is because I dyed my hair in November and then I dyed it again in the beginning of January. I waited longer than the perceived time you're supposed to between dyes and stuff like that. I did it at home. And my hair got really, really damaged. And I'm sitting there and I'm messing Josh about it, being like, I don't want to cut my hair. I know it's just hair. I don't understand why I'm sitting there and freaking out about it because it's just hair, but it also doesn't help that. So when I first started at my job 5 years ago, it was extremely warm that summer. And I have very thick hair. So if anybody has thick hair and it's long, you understand the pain
in the butt
of trying to keep it up without causing headaches because you're sweating so much because it's very hot.
Yes.
And so I decided to get a cute little pixie cut. And then the men at work that would come in, customers, gave me a side eye and started treating me different and everything. And then there was a nice lady and her partner. She started a landscape business, and they asked if I was single, and I was like, no, I have a boyfriend. They're like, oh. I was like, why? They're like, we thought you were a lesbian. I'm like,
pixie
well, I'm
lady.
pansexual, so to me, sex does not matter.
Uh-huh.
So you're not wrong.
And they still looked at her and went, so,
Yeah, but
how you doing?
It was one of those things where it's like, I'm like, great, everybody, and there's nothing wrong with it. I was just like, it was that stereotypical label that was put on me, and I'm just sitting there like, I don't want to cut my hair. People thought I was either a boy last time or that I was lesbian, which again, there's nothing wrong with that.
It.
I just don't want to sit there and have that awkward conversation if I'm out with friends or something, which rarely ever happens since I rarely ever leave my house. And having to have that awkward conversation of, oh no, I'm sorry, I'm not interested.
Sorry, wrong
but
team.
Skin and vein appearance, which I can understand that. I have a lot of burst blood vessels in my face. So the blemishes,
Is that
they'll
from
start
smoking?
to bother me. And yes, it's probably from smoking. I don't
Because
want
I
to hear
have
it.
some in my cheek that it looks like I
Yes.
have
Well, see, mine
varicose
are
veins.
actually like
So,
on my nose.
remember, guys, when you smoke, your blood vessels will constrict.
I haven't smoked in like 3 years, so
It will still happen.
I was just letting you know I don't smoke anymore.
I know. I was there for that journey.
Yeah.
Trust me, I was there.
Oh boy, were ya?
Breast
Yeah.
size is another one, which I struggled with that one for the longest time. And now I'm like, you don't like my mom boobs? Go away.
Yeah, me too. I struggle with that one a lot.
I struggle with that too.
Sorry.
They like I used to be perky. Now I'm not perky.
I know.
God.
Damn kids and gravity.
But my husband still loves them.
This is the part that I can't identify. Sorry.
Muscle size and tone, and this the last one is why I can understand why me and Laura are confused, where we thought people who are trans had BDD because they say genitalia.
Oh, butt implants, penile implants.
Yeah, and I think
vagina.
and I will admit that my mind was closed off to thinking that, oh, well, if a man goes and gets a penile implant, he doesn't have BDD. He just wants to be able to get an erection. And Viagra obviously didn't work for the man.
There's also penis. I say this with air quotes. There are some men who think that they can get penis enlargement surgeries. Don't do it.
So the cause.
Sorry.
Anyone guess what the cause is?
For what? For butt implants? I've lost where we are.
No, people having BDD.
Oh, no.
I'm guessing it's environmental.
Family?
It's not known specifically what causes body dysmorphic disorder. Like many other mental health conditions, body dysmorphic disorder may result from a combination of issues such as a family history of the disorder, negative evaluations or experiences about your body or self-image, and abnormal brain function or abnormal levels of the brain chemical called serotonin.
Yes.
So
in
a
my
lot
case,
of it is environmental, how people react to you, how.
Yep.
Because like
huge
it
mental
got
thing.
really bad for me, especially right after having my oldest son. Is I was 115 pounds when I met my ex-husband. I got pregnant. I got up to 135. Pushed that kid out, back down to 115. Like no issues. The only like I walked out in the clothes I used to wear. No issue at all. Came up like 2 months after he was born to visit my mom, my dad, have everybody meet him. Walk into my mom's house.
And she makes a fat joke, right?
Wow, you got fat.
Yep.
And I'm looking at her like, what? I'm 115 pounds. I've never been over 115 pounds. Besides, when I was pregnant, how am I fat? So, needless to say, we sat there for like an hour or two, let her meet my oldest son, and got up to my dad's. And I loved, and I can make my meatloaf exactly like my dad's. Like, it is my favorite thing in the whole entire world to eat. If I could eat it every day, all day, I would. He made meatloaf, and I'm literally pushing it around, and he's like, "What'd your mother do this time?" I'm like, "Nothing."
Oh,
And he's like, "What did she do?" He's like, "Usually you devour half the meatloaf by now." And even my ex-husband was like, "She called her fat." And my dad never like yelled or screamed, but he got a look on his face, and he's like, "Eat your damn meatloaf. I made the goddamn meatloaf for you. Eat the damn meatloaf. You're not fat." But it's stuff like that. Like, people don't realize that you poke fun at someone, you don't know their family history, if they get abused at home with that same kind of stuff. You don't know if they already have depression or anything like that, to the point where they could get a disorder like this. And a lot of people think it's fake. So a lot of therapists don't focus on things like BDD, and especially like for me, BPD. There are very few therapists, or even if you're going through a mental health crisis, like let's say you finally had enough, you've been teased for weeks about, let's say, your stomach,
mm-hmm.
and you're like, "Well, I just want to end it all." If you go and try and commit yourself, they think you're just looking for attention, because a lot of therapists need a cause, like your brain chemistry, you have family history of it. If you don't have the family history, they look at it and they're like, "Oh, well, this isn't something serious. You're just screaming for attention." And that's why a lot of people who have BDD or BPD don't seek treatment, because they're not taken serious.
Right. And which is stuff we talked about. Now I know also at Chesh, you had the same situation with someone always telling you you were fat when obviously it's not true.
I didn't specifically get told that I was fat in like blunt, lamest terms. My grandmother on my dad's side uh wasn't always particularly keen on like my mom and made comments towards her a few times, and I just so happened to hit the lovely age of puberty. That sweet old 11 to 12, you know.
Well, don't talk about that right now. Ugh. Mm.
So I am a very curvy hourglass kind of shaped girl, and it she would make comments in regards to how I dressed, how my body looked. Oh, we don't wear this. Oh, we don't wear that. Oh, it's okay for these kinds of girls to wear dresses like that, but it's not okay for you to do these things. Laura, I've told you specifically about moments where I'm completely covered head to toe,
Uh huh.
you know, long sleeve, jeans, I have boots on, a full on like cardigan sweater on, and it's hot as fuck. I'm down here in Florida. So I'm wearing all of that, and I'm probably like, I don't know, 15, maybe a little younger than that. And she's just sat there. I took the cardigan off because it's hot and just sat there making comment after comment after comment about how I'm dressed. Oh, you have too much cleavage. Oh, this, oh, that. Ma'am, I had no cleavage. None
Even
at
if you
all.
did, there's nothing you can do about it.
Exactly. But it was just comment
Bitch.
after comment after comment. And I got to a point where I had to kindly excuse myself because I was raised that you don't, you know, negatively interact with your elders, especially if they are family, even if they're doing things to hurt you. So I excused myself. I got on my phone. I texted my mom, and my mother pretty much called my dad, telling her that it's time to go because your daughter's about to go ballistic on your mom. Her words, not mine. And I trust me, it's my favorite thing to say because it's funny to me. But we leave. My dad asked me what was going on, and I told him. And of course, my parents had a conversation, and that's roughly the last time I ever saw them.
Oh,
I've worked And Laura can attest to this. I have worked years and years and years to get to where I am actually comfortable with my own body.
Hmm.
I have days, just like you do, Jesse, where I look at myself and I'm like, fuck, I can't wear this today.
Hey,
Or
I
my
caught a
stomach's
man with the
big,
way
or
I look, so obviously at least one person in the United States or in this world finds me attractive. So
I trust me, I have that same thought process of like, oh, well, so and so found me attractive, or da 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 da. Dating apps are wonderful, people. They'll let you know how pretty you are, and you'll just boost your confidence right there. I'll tell you that. Just don't interact with people. Just get the compliments. It's nice. If you ever need a confidence booster, just go on Tinder, post some nice photos. Trust me. Um, but it had taken me years, and also at the time being a dancer before my injury, I was already very kind of self-conscious about my body because again, here I am, I'm a larger chested woman. I have a bit of a tummy. I don't look like all the other girls who are,
okay,
A
but
and B
you
cups
also need to
and
remind
flat.
people that you are not very tall.
Yes, that being said,
So
I am 5'2". Let's
so
put that
if
out there.
you
Let's put
ever
all of
do
Chesh's personal
well, no,
information
no,
out
no.
there.
I'm just
I'm five
saying
foot
because
two.
I'm just saying if you ever mention how much you weigh later on
Yes,
during the podcast, at because that does matter because they may think you're like my size, which is
very true.
5'8",
Jesse,
and
yeah,
if you
Jesse's
say
5'8".
your weight, if you were my weight or if you were my height, that would be what you weigh now would be the ideal weight for your height.
True.
So it
So,
also matters at the fact that she is a smaller person.
yes. So put it in perspective. We'll talk about
You don't have to
teenage.
say it. I just wanted to
No, no,
reiterate
no, no,
that.
no. I'm gonna put it in a bit more of a perspective. Around teenage Chesh years, because I can give this information because it's not current. I was 5'2". I'm still 5'2". I didn't get surgery. I understand I put that in past tense. 5'2", roughly 120 pounds at the time. Larger cup size than I feel comfortable saying, just for all you pervs out there. And I didn't look like everybody else. I didn't look like all the other ballerinas that were around me, all the other dancers that were around me. So it really messed with me when even hearing sometimes my dance teachers when it came to costumes would make comments about my bust size, being that
They
again,
just jealous. They part of the
I
itty
know
bitty titty
everybody
committee and they
jealous.
just jealous. Bitch.
But, being a teenage girl, and of course we get sized for costumes even before I was a teenager, and I'm talking like, 11, 10, 9 even, getting sized for costumes and going from being a part of the itty bitty titty committee to the not so itty bitty titty committee is very jarring because I didn't get the opportunity of training bras. I went from
Nothing to
nothing
everything.
to everything and underwire
Yeah.
and oh my God, what are these? So my grandmother was not the kindest when it came to accepting how I looked. And like I said, just to wrap it all up, it has taken me years to get to a point where I can look at myself in the mirror and go, you know what? I'm happy with how I am. And that being said, I am a Crohn's patient, as we know on this podcast. So my weight is not personally where I want it to be, but medically where it needs to be. And I,
I sorry, go ahead.
no, no, no. And I'm just saying I can find comfort in that. It may not be, it messes with me sometimes of being like, oh, well, I'm 100 and da 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 pounds when I should be, X pounds. But for those of you who medically need extra weight on you, do not like numbers don't matter. As long as you're healthy, numbers don't mean shit.
So I'm older than both of you.
Not by
And
much.
Jericho and I were talking last night, because I've noticed that some of my body parts look like old lady body parts now. Like my lips are thinning. Like, when you get older, your lips start to thin.
Yeah.
And I have crow's feet, which I've never noticed before.
Hell, I
So
think I even have crow's feet.
Yeah, so I'm like not
I
happy
don't
about.
believe in crow's feet.
I love
You
the fact
beautiful.
I love the fact that my hair is turning white. I've always wanted white hair. I don't give a shit about that
I
at
know you
all.
have. I know this is like, yay.
But my lips look like old lady lips. And I think what bothers me is the fact that they remind me of my grandmother and the fact that she's no longer with us. Like
Mm-hmm.
she was old. She passed. And now I see this and I'm realizing, oh shit, I'm getting old. You know? I think
Mm-hmm.
that's where my issues come in. And
And
there's
those
nothing
are
there's not
natural.
yeah, there's not much that I can do about my lips. I'm not gonna go get surgery or Botox or anything like that. That's
Well,
not me. That's not who I am.
it's kind of like growing up, I could never tell who I looked like because I don't know what my biological father looks like, and I never thought I looked like my mother until she passed away. And we're going through all of her pictures, and my siblings just stop and they're holding up this picture, all staring at it. I'm like, what the hell are we looking at? They're like, you look identical to mom. I was like, no,
You tell them all to
no, I
fuck off.
don't. Shut your mouth.
Yeah.
And they showed me, and I'll struggle sometimes being like, great, I look just like my mother. That's what I really wanted.
Yeah.
And it's not because I didn't think she was attractive. It's just I'll look in the mirror at times and be like, great, I look like my tormentor.
Yeah. Yeah.
Yeah.
Awesome. But so funny, so the treatment is
Mm,
cognitive behavioral therapy, which is very, very similar to what they use for BPD. BPD though is the reason you can't use you can't use oh my god, I cannot think of it right now. The term there, it's two different things. Is because the one for BPD is strictly only made for BPD because the person who invented the type of therapy actually also had BPD. So, but cognitive behavioral therapy will focus on helping you learn how negative thoughts, emotions, reactions, and behaviors maintain problems over time. It challenging automatic negative thoughts about your body image. So it's pretty much rewiring your brain.
Mm-hmm.
yes.
But then they can also add, which is just like BPD, is SSRIs. Now, if those magically disappear, then there's really not much else because the SSRIs can just help with like the depression part that goes with most likely be with it.
Right.
Or it kind of ups your serotonin level to make you not as down about things. But there's no like where with bipolar you can take medication and you wouldn't necessarily have to go to therapy, but you still have to go see a psychiatrist to adjust your meds when needed and stuff. It is always recommended, people, to always go to therapy, though. If you are diagnosed with something, go to therapy.
And be honest with your therapist. Don't
Yes.
hold anything back.
But people who are bipolar may, let's say, go through therapy for a year or two, but will always be on medication for the rest of their life, but they only have to go to therapy for a year or two. Whereas conditions like this, you may have to go to therapy and then do this type of cognitive behavioral therapy, but then your therapist finds out that, oh, well, you also have childhood PTSD, which caused this. So now we have to do a childhood PTSD therapy to help alleviate the symptoms blowing up with this. Where there's not, well, here we can do therapy for a year or two, and then we'll just adjust your medications as needed, and you can go on your merry way. So a lot of coping and support things you can do is you can write in a journal.
You can
Don't
surround yourself
become
with bad bitches.
isolated. Do not isolate yourself. Now, in
Hey.
cognitive behavioral therapy, they will teach you how to avoid negative social situations, but that doesn't mean stop being social and leaving your house. Don't make important decisions when you're feeling distressed or despaired.
Yes.
Stay focused on the goal that you've set for yourself. Join a support group if you can. I know sometimes that's a little hard because support groups, depending on how they are structured for things like mental health issues, I always recommend if you can find a support group with a therapist at the head of it, that is better than trying to just go to a support group where you could feed off of each other.
Yep.
Where if someone's feeling down and they're talking about it without someone to help control the situation to a point, it could be a domino effect for other people where they may be feeling fine, but then they hear that and like, oh yeah, I feel the same way.
I do want to stress, like Jesse said, don't make extremely important decisions, family, medical, anything, when you are in a bad place. Sometimes you're going to end up hurting other people or hurting yourself, and it's not going to help anybody.
Yeah,
stick with therapy.
Stick with therapy, people. I can tell you.
I'm in therapy. I'm enjoying therapy. Stick with therapy.
Even if the therapy, at least the specific courses, because I don't know if cognitive behavioral therapy is like the one for BPD, but I do want to stress that even if, like, for the therapy I had for BPD, it was a year-long commitment. I made it like 6 months before I bowed out. Yeah. And I still have my book. I still read through my book. That's why I've been as stable. I shouldn't say stable, but doing as well as I have been is because every once in a while it'd be like, oh, okay, creeping thought, and I'll go through the book and be like, I know there's a thingy for me in here. I just got to remember which page it's on.
What my therapist and I have been working on is staying more in the moment and looking for what we call glimmers. So like happy, positive things. You passed your test, you got up this morning, you brushed your teeth.
You joined us for the podcast.
Joined for the podcast. You know, you are making it through your day, and you just find these little happy things throughout the day. So if you can work on staying grounded and staying in the moment, it can help a lot when it comes to how you feel about yourself and your body.
There is a body dysmorphic disorder foundation that does have a lot of support resources. It is bddfoundation.org.
We will link it in the description below.
Perfect. But we do have to call it there for today. So thank you so much for joining us on our podcast today. We will be back soon, in 2 weeks, with another podcast. So please come join in the conversation. We hope to see you there.
Like, comment, subscribe, share.
Join our OnlyFans.
We don't have one yet.
Join a Patreon.
We don't have one yet.
We're working on it.
Bye, everyone.
Bye.
Bye.
Literally just had it though. I'm not crazy. I know I saw it.
I mean, you are crazy.
Yeah, I got a doctor's note and everything, so